Hi, this is Stephanie. You're listening to the Healthy Practitioner podcast, where we talk health, wellness, and all things detox. Hi, this is Stephanie Gratz, nurse practitioner. Today we're going to be talking about all things ADHD with our nurse practitioner, Maggie Gothard. Maggie, welcome.
Thank you.
All right, Maggie. So a lot of patients and parents come to me and they have this diagnosis with ADHD and they want to know what they can do naturally to help support their kids, because they come in, they're given medication recommendations and they don't want to start there. So today we're just going to kind of have a conversation about that and other integrative pediatric functional medicine, like how your approach is differently when you're treating kids versus maybe a Western medicine approach. Mm-hmm. I appreciate your expertise in the field because you have a wide background and you've worked in Western medicine, you've worked in functional, so you kind of have a good blend of both worlds, and I really appreciate that. So can you tell us a little bit about your background and your approach to integrative pediatrics and what led you into functional medicine to begin with?
Sure. So I was always a student, and because becoming a nurse, I asked so many questions. I always wanted to know the why. Well, why? And I wanted to get it down to a layer that I think my teachers almost wanted to roll their eyes, like, let's move on, Maggie. But I always felt that the more I knew, the more confident I felt as a nurse or becoming a nurse. And that kind of stayed with me. And I felt that there was so much that the conventional education offered me, but yet there was something lacking. And that's when I started to teach myself this sort of root cause approach as I was going through my education. And, was a nurse for a while and then continued on to become a family nurse practitioner. And again, learning in that conventional realm, it was hard because there was things where, you have these cluster of symptoms and we look to treatment. But looking at root cause was so important to me to provide to my patients. And so I continued that on as I became a nurse practitioner. And I think what pulled me to become into pediatrics was I was working actually in the ER in Upper Wisconsin. And once I started having kids, before that it was different. Mm-hmm. But once I started having kids, every kid was my kid. Mm. And so I felt mama bear to people in the ER urgent care. I would spend a few minutes with them. So I didn't get the time to educate or have that conversation. And fast forward, then I'm in Dubuque working in urgent care. And as the name implies, I have a few minutes with these patients, but just wanting to shove all this education down their throat in the very little time I had. So I think, I just think to be able to educate and empower parents and children is really what led me to where I am today.
I love that. And I remember when you were a nurse and you would come to me and ask me questions. And I wonder, how was educating yourself? Because when I did my education, I was Western medicine. And then I didn't start getting into integrative medicine until 10 years ago after I went through my boards and passed them. So what was it like doing both Western and integrative at the same time? Was it hard?
Yes.
I couldn't imagine.
Very much compartmentalizing material that I learned. And again, I don't want to demonize Western medicine because especially in the urgent care ER realm, there's times where we absolutely need it. Mm-hmm. So it was good that I sort of had this sort of Venn diagram that I could work with my education. But yeah, there was definitely black and white issues that I had to compartmentalize when studying for tests or for, beginning my practice.
I love that you said you were the why asker, because I think that if you're in this realm, you got to be this realm because you're why. I just told someone the other day, I'm like a toddler. Why? Why? Because I do want to know why. Because when you get into this world, in this realm, you realize the whys of some things that we do on repeat in maybe Western medicine or even in functional medicine is because we've always done it this way, or we just started doing it because of this small percentage and now it doesn't make sense anymore. And so asking why is what actually helps us move and shift our health. So
absolutely.
I love that. Well, ADHD, it's a growing concern. between ADHD, autism, like there's so many pediatric illnesses that we are dealing with in today's day and age. What are some of the underlying causes or contributing factors of ADHD that you typically see?
So I'm going to zoom out a little bit with that question, because I think a lot of times either parents are coming to me without a diagnosis, but they have their child that exhibits those cluster of symptoms that they are highly suspecting the child has ADHD, or they went to their provider, practitioner, physician, and they receive that diagnosis based on subjective information only. So the child has to fit into certain criteria of certain symptoms that they express to be able to get the diagnosis. And then you either get medication and or go on your way. This is just their lifelong diagnosis. So both of those, whether there's suspicion of ADHD or you get the diagnosis, where did that diagnosis or concern come from? And again, we just talked about root cause. So is it ADHD or is it blank? And I say that a lot to parents. And a lot of times it has nothing to do with their brain. Mm-hmm. It has everything to do with their gut, with external environmental factors, with their gut, their diet, how well they're sleeping. I say stress in adult world, but I say emotional regulation with children. So how are they regulating their emotions as a 3-year-old, as a 5-year-old, as a 7-year-old? So if one of those pillars are off over time, it can manifest into what we think is ADHD. So is it ADHD or is it constipation? Mm-hmm. So a lot of times I'll say to parents, when's the last time your child had a bowel movement? It's as simple as that. Or it could be several things at the same time. Is it ADHD or is it reactive hypoglycemia? Meaning you feed your child cereal in the morning and then maybe a waffle and a piece of toast, and then they go to school. So a pretty high processed, high sugar diet, or those foods break down pretty quickly into sugar in their bodies. There's a giant spike in their blood sugar, and then there's a drop. Reactive hypoglycemia can manifest symptoms very, very similar to ADHD. So what I try to do is, have the parents learn how to play detective before they jump to that conclusion. Or even if their kid is diagnosed with ADHD and they're trying to manage those symptoms. Well, have they pooped today? Are they hydrated? Mm-hmm. There's things that we can't control. Being in school, sitting most of the day, it kills me for these kids. And that's no fault to the parents, obviously. But when they get home, are they running around? Are we throwing them right into organized sports and then into homework and then sleep, or can they just run? So kind of straying off that question, but I think it really comes down to focusing on those pillars of health, and maybe there's some imbalance and what is truly manifesting these symptoms.
I love that, because I think that we want to see our children thrive. And so then we hear usually from a teacher, like, hey, Johnny's not paying attention. Mm-hmm. And so then it's like, oh my gosh, he has a problem. So then he goes to the doctor has 5 minutes with them. They get diagnosed with ADHD from this basic, question list. And then they get these interventions, which do have major long-term implications, and we can talk about them later. But like you said, like, are they able to stimulate their nervous system when they come home? Like they're sitting down all day, they're letting all of this stuff build up. Are they able to run around at home? Like, what is that? So what do you feel like is most successful in your eyes and what you've seen for people, like after school, after activities? Do you find it beneficial for them to be in different sports? Do you find it beneficial for them to be able to just run around? What is it?
I think that can vary based on the family, the dynamic, and there are certain parents who sort of need to put their kids into organized sports because of external factors. So I don't necessarily want to, make that a negative, but how I feel if there is a choice in the matter is with organized sports and organized play, there leaves little room for creativity. And there's been plenty of studies that show brain development and just cognitive function is, blossoming those first 5 years of life and into the first 10 years. And so what are we doing to help facilitate that creative play, that imagination that we had as children, and hopefully some adults still have?
Yeah.
So that really comes about with boredom.
Yeah.
And just get out and figure it out. And I think sometimes parents can feel like they're bad parents because they don't have everything structured. But, After I tell I have 3 daughters, I have a 7, 5, and 3-year-old, you'll figure it out. Mm-hmm. And then when they come back with something or they get lost in their play, that's when it makes my heart feel happy.
I love that. Oh my gosh. Yes. And I think you said a big key word of like the unknown, like not having anything planned and being okay with that. Because when we have a cell phone in our hands 24/7, like we don't have time to allow for creativity, right? We're just constantly like trying to get the next hit of dopamine, and it does ripple off into our children. Like whatever, if it's TV or if it's Cocomelon, something like that, so shutting off the TV for both of us and, having something creative that we both like to do. And like you said, kids will figure it out. You give them a couple tools, a toilet paper roll and scissors or marker, like they'll figure something out. And so allowing that creative play, I think is so important. So I'm glad you touched on that.
Yeah, I agree.
To me, ADHD, one of the, biggest factors is gut health. Let's just dive into gut health.
And the link, right?
Yeah.
And that, I think one of the biggest frustrations with mental health in general, but specifically we're talking ADHD today, is this brain disorder. The brain and the gut are connected. And so this is a whole body sort of issue that we need to address. And especially with gut health, you talk about that. So our neurotransmitters, they are primarily created in the gut. Mm-hmm. So when we talk about mood regulation, when we talk about irritability, when we talk about, even mild forms of depression, anxiety, is it coming from their brain or is it coming from their gut? And with that, to take it a step further, well, then we have to play detective. So what maybe is causing those gut disturbances?
And this, I want to say, this is really important because up until like 14 years ago, the brain produced all of the neurotransmitters per scientist's thoughts, right? Like research was, every serotonin, dopamine, all of those were regulated in the brain. But then they realized that actually, I think it's almost 80% or more are produced in the gut. So when we have leaky gut or a gut disturbance, it's not only affecting our whole body, but it's definitely affecting neurotransmitters that are related directly to our brain.
Absolutely. Mm-hmm. Yep. And just being able to then hone in on how can we make the belly healthy. And it's having those conversations with your child. So depending on the age, we have to sort of adjust our vocabulary. But, again, speaking on the ages of my children, I have to adjust, but kids are so smart and they want to know the why. And when you give them a why, more times than not, they're compliant. So what is making my belly hurt? Well, we can point to certain, maybe snacks or treats that they're eating. Are they drinking enough water that's making them constipated? We need to poop. That makes our bellies happy. That makes our brains happy. That makes us really smart. Once they get that connection, there is an intrinsic motivator that can come about with very young children. Mm-hmm. And then it's not so much on the parent to, you're just forcing it, or I have to because my parents tell me I have to eat this or do this. They have their own internal why. And that's one of the beautiful things I've noticed working with children and working with my own is, oh, wow, you're way smarter than I'm giving you credit for.
Mm-hmm. Oh my gosh, that's so true. Oh, yeah, there's so much to talk about with gut in general, like talking about leaky gut. So what are the things that break down the gut barrier that lead to having these issues?
That's a very good question. And unfortunately, it can come before baby's even born, before baby's even in utero. So it starts before mom is even pregnant. So, there's a lot of factors that can sort of cascade into a higher risk of having leaky gut in a child, which I think is the focus today is with just children. So just talking about that, again, first 5 years of life, the amount of antibiotics that we're giving our children, over prescribing. Again, I worked in the urgent care space. Mm-hmm. There is a time and place for antibiotics, but they are widely overprescribed. And unfortunately, with antibiotics, they kill not only the bad bacteria, that's the point, they're also killing the good bacteria. And are we replacing that good bacteria? Well, if we're not, the bad bacteria starts to proliferate over the good bacteria. And then that's how we can start to have this leaky gut. Well, what is leaky gut? The best way I can describe it is we have this tight juncture between our gut lining and our blood. And once the lining starts to be permeable, we start to have food particles that can go outside our GI tract. It's not supposed to go outside our GI tract. Yes. Enter food sensitivities, food allergies, a lot of skin issues, a lot of mental health issues. Aside from medications, just the food. I mean, and again, not blaming parents, but we are just set up for failure a lot in this country because the foods that we find in the grocery store are highly processed. They have a shelf life of 6 months, a year, several years. I mean, you name it. And that's the bulk of our American diet. So over time, that can lead to leaky gut. And then, other medications that are given. So it could be one of those things, but if they're all happening at the same time, pumping Tylenol in our child every single time they even have a low-grade fever. Again, all those things can contribute. And if there's nothing that's really supporting or offsetting that, it can create an array of problems.
I love that because that is really a typical standard American approach to life, right? The processed foods, the Tylenol, the suppressants before they're even born, and then when they are born, just the immune dysregulation that they get. As you were talking about the leaky gut and the synapses, like when your gut has the process, your gut has to process through all of these chemicals that are in the processed foods, right? So at one point, the gut just gets broken down. And then, as you were saying, these particles get into our bloodstream that shouldn't be there. So then our immune system's on high alert always. And it's just oh, those shouldn't be there. And it's tagging them to leave the body. And if it's recognizing that, and then it's recognizing our own cells, as very similar, which they can be, a lot of them are. Thyroid cell can mimic a lot of these type of cells too. Then all of a sudden our body's oh, I don't think that should be here, even though it's a normal, healthy cell. So then it starts removing that from the body. And then we get these autoimmune issues. You see the kids with severe eczema, which breaks my heart. But that, again, that's a reaction from having metals or toxins overloaded in the body. And we really have to work, like you mentioned, on getting those junctions. They can close. So it's not, if it's happening, it's not it's an end all be all, which is great. Our bodies, especially young kids, they have the most stem cells that are produced and they're flowing and ready for repair. So they have optimal opportunities if we don't keep assaulting their system. Mm-hmm. So it's perfect time to okay, stop filling up their cup with toxins and let's start decreasing it and supporting their system, as you're mentioning.
Yes. And you bring up a great point with just, these are common things that we're seeing now, but common doesn't mean normal. And to remember that, and if those are things that you as a parent have been struggling with your whole life, and people around you have been struggling with, and their kids are struggling with it, that doesn't mean it's normal. And there is control in that, but to take away the commonality with it and just focus on, is this the way we should be feeling at 5 years old, 7 years old, into my adulthood? No.
Should I have to be giving my kid nebulizers every week? Should they have to be giving them suppositories? I remember I was 2 years old and I had constipation, and you're mentioning your 2-year-old's smart. You could see if their belly's hurting or give them more fluids. But at that time, especially back in those days when we were growing up, our parents relied heavily on doctors' advices, and the doctors really didn't give great advice, And so it was just okay, here, take this medication. And then it's just, again, you get on this intervention train and it's hard to get off of it once you start. So really trying to get back. And, you mentioned a really good point about Tylenol in the system and how you have to offset things. And Tylenol's a big, whether it's ADHD or just our children in general, Tylenol is something easy that every doctor will tell you to give your kid if they have a fever. But I have taught this, and I want you to see what your thoughts are. But fevers are good. Fevers are important. That's how our body actually builds its immune system. When it sees a foreign antigen, our body increases the temperature. It releases white blood cells and other immune lymphocytes, all of that to help clear the infections. So if we are suppressing that fever, then we're not allowing our immune system to grow. And over time, if we keep suppressing that, we have a weakened immune system. So when I'm treating patients, especially the older patients, when they start having fevers, we celebrate because they've been suppressed for so long that they haven't been able to build an immune tolerance. So I don't know what your thoughts are on fevers and Tylenol. And
oh my God, you pulled pulled the words right out of my mouth, and you said it perfectly. And no mother or father wants to see their kid uncomfortable. And that's the whole point of why they're doing it, is they just want their kids, they just want their kids comfortable. They want to keep them safe. So the intention is there. Again, this is nothing on the parents. It's just our public health and our education that we're providing those parents. But to your point, and I agree wholeheartedly, knock on wood, I have yet to give my kids Tylenol. Will there be a time and place? There might be, and I am not afraid to use it, but I have other tools in my toolbox.
Yes.
And I welcome that. And I also discuss that with my children, that you're not feeling good, you're warm. And like I said, you just mentioned that there's a reason why, and explain to them on that level so they understand it. Instead of Tylenol and, over-the-counter cold medicine, which plenty of studies will say under 12, it doesn't do anything anyway. It's usually loaded with sugar, so it's doing the opposite. But I have zinc, elderberry, vitamin C, vitamin D, plenty of rest, all the water. And they usually rebound pretty quick, most times, because as a parent, we don't have time to take off work and be home for several days with our kids. And so to your point, by suppressing that fever, it's making the body work twice as hard to fight that either viral or bacterial illness.
Yes. Oh, I love that. And the tools of your toolbox. I love that analogy. I will never stop using it. It's just like parents, we can't fault them for having Tylenol and ibuprofen in their toolbox and that being one of the limited. But what if you can expand your toolbox? So now you have that, then you have the vitamin C, the vitamin D, you have onions that you can put on the kids' feet. Honestly, for us, it's just give us, our mom brains, a modality. It doesn't matter what it is. It could be a placebo effect, because no matter what, that thing's going to run its course, probably in the same time if you let it just run it versus giving it an antibiotic, but it's just making us feel better, right? So homeopathics, I love using them. Does it work? It doesn't matter. It works in the time it needs to, and then I'm giving my baby a homeopathic.
Yes.
And it's non-toxic. It's not hurting. I do remember too, when you became a nurse practitioner, you worked, down the road from me, and your patients would come in from the acute care getting garlic mullein drops for their ears. And I'm just like, oh my gosh, I loved it so much. So empowering. So there is, no matter what, even if you are a practitioner in whatever field you're in, you have that opportunity to also add in tools to people's toolboxes. So again, garlic mullein, we can talk about that. And I know we're on ADHD, but these are things that no matter what, if you have ADHD or not, these are things that you will experience with your kids, and just giving more tools. Garlic mullein, that was something for Lainey when she was teething. The eardrum is so close to the immune system. So that's one of the first things that kids will tug on and pull. Up to 90% or at least 80% are viral in nature with ear infections. And so we don't treat them with antibiotics to begin with. And if they are getting better when they have antibiotics, it's just because it was running its natural course. So garlic mullein, very safe, natural. It's helping the whole body systemically, just dropping it in their ears. They're fine with it. It's just one that was a saving grace for us. So
absolutely. And to tell parents, if it makes you feel better, give yourself a couple days. Say, I'm going to have the garlic mullein drops on hand. If I don't feel improvement, certainly if they worsen and there's concerning symptoms, you take them in, but start with that approach and you'll be surprised how quickly they'll rebound, or at least this symptoms will start to improve. But you can always have that feel good if you want to say, okay, well, if it doesn't help in a couple days, then I will go to, urgent care. I'll go to my doctor, but just know that be patient and allow these natural modalities to take effect and see how resilient the body can be.
I love that. And while we're just talking about that too, doing the things that will help naturally improve your immune system at that time too. So dairy products produce a lot of mucus. So they contribute to a lot of ear infections and upper throat, airway stuff. So if your kid's having sinus, ear, remove the dairy. Just do it. Even if you're doing it while they're sick, but even try encouraging, do it for 4 weeks and see, because there's kids that have, Lainey's never had an ear infection, knock on wood. I'm just lucky that way. Maybe it's luck. Maybe it's something that I'm doing. But honestly, taking away that stimulus, I've seen so many kids that haven't had to get tubes because they've taken that away. And then again, the garlic mullein, just doing that, but improving their immune system, make sure they're not getting a ton of sugar because that's dropping their immune system, not allowing them to heal themselves. So I'm probably going to get some controversy for that one. But I mean, if you have kids that have ear infections, sometimes they do have some anatomical issues with that and they can't prevent it. But a lot of times we can.
Yes.
So going back to ADHD, what about testing? What do you recommend when you have a kid that comes in for ADHD? I know there's a lot of integrative testing that we can do.
There is. I am one I like to take the least invasive approach with kids. So, as you mentioned, going back to removing dairy for 4 weeks. So typically when I talk to a family, before I do any of that, I want to address the lifestyle dietary factors. And at least to see if there's some improvement. A lot of times it is driven from those, things, the low-hanging fruit, right? Oh, it's artificial flavors, foods, dyes, and we can get into that, or if it's just processed food. But after a few weeks or a few months of them implementing, and addressing those pillars, if they still want to look in further, or if, their symptoms are improving, but God, they're not really where they should be, I just feel like I want to look more deeper into what's going on. That's when I look into specialty testing. So heavy metals can absolutely be a factor and be contributing to some of those symptoms. The beauty is it's a urine test, so I'm not having to poke the child. There is another urine test called the organic acid tests, and that is truly my favorite test because it can give me so much information on gut health, on brain health, how they're metabolizing, how well they're utilizing and processing energy. So that can give me a lot of information. And then the non-heavy metal toxic tests. So unfortunately, glyphosate is everywhere, especially in the state of Iowa. So seeing if there's high levels of glyphosate that's contributing to some of these symptoms. So again, it's more specialty test, urine and sometimes stool-based. And then we can always move into blood tests as well, looking at some of those nutritional deficiencies, looking at leaky gut. So it's sort of dependent on the patient.
Great. I love that. And I love that they can feel empowered. First, you're doing the simple things, just the clean up of the life. And a lot of times it's something that we do every day and we don't even realize that's like, oh, shoot, I shouldn't. We can just easily swap that out. And then going deeper, like we don't have to start most invasive first. And then, like you said, the oat test, heavy metal, glyphosate, great resources, and they're non-invasive. I know that you do blood work as well if that is needed, if something else is coming up for a kid. So it's not off the table, but I'm the same as you, as like the least traumatic medical experience possible for kids so that they don't have long-term traumas. So let's say you get these results back. There's probably 5 things that you're telling most of your patients when they come back. Like, okay, so they do have high glyphosate. They do have high heavy metals. What is your kind of protocol that you're doing for that?
So it's a combination. I mean, specifically with heavy metals, there is a heavy metal like detox protocol that I would put the child on. Obviously everything is based on weight with a pediatric patient. So, we do that very safely and make sure that, the body is able to handle that detox. And whether or not they're put on anything, opening up those detox pathways are so important. So what does that mean? We're peeing, we're pooping, we're sweating. And kids need to do that too. Yes. So making sure your kid's pooping every day. If they're old enough where you're not checking, ask them. Does it hurt when you poop? Does it take a while to poop? Like, those are important questions to know because they might not tell you. They're not going to know the difference. Are they getting enough water every day? So are they peeing out their toxins? And then, of course, running around. Usually kids want to run off all their energy. So
because there are things that they can do. Like, let's say they can't afford to come in and see you at the clinic or do things. There are many things that they can do at home on their own, right? Like making sure the detox pathways are open are just so important. I know we have some ionic foot cleanse baths here, and the ion detoxing really came about from kids that had ADHD and autism and how great it was to detox their bodies. it's easier for adults to detox because there's different ways. We do coffee enemas, we do vitamin C flushes, we do saunas at high temps. Women have their cycles and their period is a form of detoxing. Kids just have less opportunities, but also typically they should be less, dirty. Their cup shouldn't be as full, whereas they can do these simple things. And if we're just getting their balls moving normally, then that will help solve so much of their problems. Mm-hmm. Okay, there's often a rush to medicate children with ADHD. What alternatives do you typically explore with parents? Let's dive into whether a kid should ever be placed on amphetamine medications.
I think when it comes to medication specifically with ADHD, it's about, at least where my mind goes, is are they safe? And is this something where we see as acute, like severity? So, I would even try to give the analogy of depression. So if there is a child or an adult that has severe depression, and they will seek harm, and there are kids on the spectrum that also are, can harm themselves. It may be appropriate at that time to intervene with a medication quickly. So at least we keep them safe. But I always say simultaneously, we are bridging with something more holistic. We are addressing those pillars. We're making sure we are supporting their brain with optimal nutrition, healthy fatty acids, making sure they're moving around, counseling, having somebody that they're talking to. Is this a, family where parents are together, they're split up, they're moving around a lot? Kids crave consistent patterns. So is that disrupted? So to bring that all in, if their safety is compromised, I 100% think that that's appropriate. I do like to see it on an acute short-term basis, and we are monitoring them frequently. We are starting with the lowest dose possible, and then again, bridging with the sort of integrative approach to make them overall well.
Yeah. Oh, I love that. That's really good. So it should never be a first line treatment. Mm-hmm. I do think, as you're talking to, is their thyroid optimal? When they're having those symptoms, especially if they have autism or something like that, a lot of times they can have nutritional imbalances. Thyroid can be off, iron levels, they can be anemic. And if we don't address them and we just throw them on an amphetamine, we don't ever know what's actually going on. And then they just get into this train of having all of these symptoms. So I think really finding the roots and looking at least at a good baseline is really important for them.
I love that. I love that you touched on that, because that is sometimes where blood work comes into play. But it's just simply, are they getting too much iron? Are they not getting enough? Is their magnesium so depleted? I mean, if you just want to research for 5 minutes online, you'll find the statistics alarming that, children with ADHD are 200 times more likely to have those symptoms because they're zinc deficient versus the neurotypical kid. And it's parents are are you kidding me? If I would have known this,
right,
I would have saved myself the headache, the trouble, the financial burden. And again, sometimes it's not that easy, but it usually is something that can contribute to those symptoms.
Love that. What are some easy, actionable tips that parents can start implementing at home to help manage ADHD symptoms naturally? I think we touched on some of these, but I think there's a few more.
I think my biggest message is please don't feel overwhelmed, even though you might feel overwhelmed, because we're overwhelmed. It's 2024. Our lives are crazy. We're parents, we're professionals, we're all the things. But try to do the swap mentality. So I don't want you to go home, throw everything out in your pantry, throw all your cleaning products out, finish whatever you're using, whatever you're consuming, and then be a conscious consumer. So, okay, I just bought this snack for my child. I bought let's say it's applesauce. Am I going to get it again? I'm just going to look at the ingredients. Oh, it's loaded with sugar. And it's not really something that is completely beneficial for them. Maybe instead, I will just swap it for an unsweetened applesauce. We'll just start there, okay? Ideally, they're just eating an apple in whole form. But to just be conscious in what you're doing is going to serve you so well, and then you will slowly implement new habits versus trying to change everything at once. statistically that will not stick. So even cleaning products or simple things that you don't even think about. I mean, deodorant, body wash, lotion that you're putting on your infant or your child. Well, what is on this? And I encourage everybody to look up what an endocrine disruptor is. And you can even just look at the top 10 most common endocrine disruptors. Take a picture of it, have it on your phone, and then when you're shopping, you cross-reference the product that you're purchasing. So again, take it at your own pace, have your partner involved, make this a family decision that you are wanting to shift into a healthier lifestyle, not just for your child, but for the whole family. And everybody will find benefits to it. It happens all the time.
I love that. And as you were talking, I was like, oh yeah, there's some apps that you can use. Like the EWG app is really good. So EWG, Environmental Working Group. So you can scan in your product and it will rate it. And it will show you what toxins it has. Again, taking the work out of even having to have a list. Like you can just, it's on your phone what you're walking with. There's different apps. I don't know if you know any specifically. There's one that's like, I think Bobby K approved. I'll put it on the show notes because I know there's a few apps that you, again, take the back of your box of whatever you want to purchase. And it's like, gives you a thumbs up or gives you a thumbs down. And it's like, no, this is not approved, because then it gives you the ingredients that it shows that aren't great. And then you can look at them, and then maybe artificial dyes, whatever. And then it will show you a good alternative. So there's so many cool apps that are out there now that make it simple for you. So, and then once you start it, obviously it might take you time in the grocery store a few times around, but then you'll start getting easy. You're like, oh, that one's good. Nope, that one has a bunch of junk in it. That one's good. So it doesn't have to be that hard.
And I'm glad you touched on just being able to use technology to our advantage. I oftentimes like ChatGPT. Mm-hmm. It's my life. Mm-hmm. But I will tell parents, hey, just write in, hey, create a really easy, fast meal for my family of 5. I want it to exclude these, maybe you're on a gluten-free diet. So gluten-free options where it contains some animal protein, some veggies, and it takes less than 30 minutes to make, and populate 5 different dinner recipes.
Oh, that's a great idea.
So then you do that, and then you just have 5. You don't have to think about changing it every day, but you're just at least, rotating those meals.
And then you can get to there, and then you can say, ChatGPT, make me a grocery list.
Yes.
And make me the grocery list that has the most healthy organic brands, and you can play with it that way, but it can be really simple. Yeah, that's a great suggestion. And I loved that you were talking about, you don't have to go all in all at once. And I tell people the same as you. And then, even for me today, like I might make, I would never make hamburger helper. I would never use hamburger helper anymore just because I know what is in it. So I make a natural hamburger helper. But even with that, it evolved over like, okay, adding in maybe the fake cheeses or something like that. Then I would make it a little healthier next time, and then a little healthier. So even for myself, I constantly am evolving to what I want to be as well. So it's a work in progress. And with everything, it might be a little different. So as long as you're going like a step in the right direction, right? So I love that. And I typically, my approach is like one room at a time. Okay, this room, next one is going to be laundry room. Get the Tide sheets out of there. Put some wool balls in instead, essential oil, and then some natural detergents. Okay, your laundry room's done. Mm-hmm. It doesn't have to be hard. So, and it doesn't have to be expensive. People think that it's expensive, but honestly, some essential oil, Epsom salts, baking soda, vinegar, you basically can clean your whole house. Mm-hmm. And so it really is affordable. And
especially with the diet too. I mean, yes, if you are moving to more of a clean, organic-based diet, it is pricier. But getting creative too. I mean, a lot of times we'll get a huge rotisserie chicken and have that be the main part of the meal. And then the next day I'm using that for a chicken salad, or I'm using it, to make a chicken sandwich, whatever the case is, but just to be, sort of mindful of how can I get creative with the foods that I'm purchasing in bulk, or if I have a large family. It just takes repetition. It just takes trying new things, but to not, get too creative all at once. Just start with some staple dinners and then go from there.
I love that. And buy in season. Strawberries, you'll eat your strawberries in the summertime when they're fresh and from the gardens and the most affordable prices, and save the $7 organic ones until, save those or use frozen ones while they're not in season. Like, there's ways to still get organic and save money. You just might have to look at different variations of how they're produced. We're talking so much about diet and lifestyle. Artificial dyes, let's just talk about artificial dyes. How do you find them on the packages? What they've kind of sneakily changed into more recently, like changing the names of artificial dyes, and why do we care about avoiding artificial dyes in kids and adults?
Mm-hmm. And I think there's more traction and more attention on this, which I love. I'm very optimistic that we're moving in the right direction as far as exposing this. Unfortunately, we've known that artificial flavors and dyes have been toxic for a while. Mm-hmm. In fact, Europe does not allow those products in their food. Mm-hmm. They're banned, and they've been banned for a long time. So if we think about that, how is it that we are allowing those dyes, those flavorings to be in our foods, in our medications to our children, where there's other countries that are banning it? Well, clearly something is wrong there. The biggest thing coming back to ADHD is its effect on behavior. So, and I would challenge parents now, if you give your kids your typical candies that contains high fructose corn syrup, just watch their behavior. I would encourage you to give them a somewhat healthy meal, but then if you give them Skittles, watch their behavior versus if you would not give them something with the high fructose corn syrup. It's almost as this, and I've been talking with parents, that it's like their personalities change completely. And then they're just bouncing off the walls, or they're more aggressive to their sibling. It can manifest different ways, but that the sort of central sort of idea on it is that the child changes in a negative way. So, our body's ability to metabolize and break down red dye 40, yellow 5. I mean, our bodies look at that like this is poison. It needs to be rid of our system, and kids consume these products every day. So sometimes it's hard for parents to even be able to differentiate, well, is it the artificial flavors and colors, or is it something else? That can just be a simple swap is cane sugar. Cane sugar is real. Cane sugar is sweet. I give my kids treats. I'm not afraid to do that, but our bodies know how to break down cane sugar, or coconut sugar, or maple syrup, or honey. So we don't need to deprive our kids from sweet foods or sweet treats, but just ones at least that their bodies are able to break down in a way that's not toxic for and again, coming back to ADHD, for their brain.
Yes, and when you're talking about high fructose corn syrup, so let's talk about Skittles or whatever candy. So not only does it have these artificial dyes, it has high fructose corn syrup, which is very inflammatory to the body and to the brain. And so, and what people don't know is that the way that they process the corn to make the high fructose corn syrup is through these metal machines that have a lot of mercury in them that actually leaches into the syrup. So I think the most recent stats that I saw was like 1/3 of every high fructose corn product has mercury in it. So not only are we like giving them artificial colors that their body has to absorb, right? The cup, when I talk about the immune system and the cup overfilling, now they have this mercury in their body, a neurotoxin that they have to. And again, it's a neurotoxin. And when we're talking about, and like, then we look at like what a population, every population is affected by ADHD, but there's probably a population, lower socioeconomical status, that has more ADHD in it. And why is that? The artificial colors, the high fructose corn syrup, were affecting their brains in so many different ways, and their bodies just can't keep up with it. And then, earlier you mentioned waking up and having cereal and a toast and waffle and going to school and having that hypoglycemic reaction. Like, how are our bodies supposed to handle all of that, all of the toxins that we're constantly giving it? And we're just setting them up for failure. So it's like, okay, what can we do that just takes us back to home base? And I think let's just talk about that while it's fresh, like breakfast choices. A lot of Americans have to get up early, get their kids to school, get to work. They don't have time to make healthy meals, or do they? Like, what is a way that they can set themselves up for failure or success?
Yeah. I love the way you phrase that question, because you choose how you're going to spend your time. And I understand the demands of life. However, it comes down to the choices that you're making, and choosing the hard right. It's not fun. And so making them a nutritious breakfast doesn't need to take an hour, but you can throw some eggs in a pan and cook some scrambled eggs, cook some, fried eggs. I don't really care how you cook them, but just that in of itself takes 5 minutes. And that, eggs are loaded with B vitamins. That's going to give them the energy that they need, the protein that they need to start their day off right. I've always wanted to ask teachers, when do you find kids have the hardest time during the day struggling with attention or focus or, just following directions? And I suspect that it's close, like right before lunchtime. Because again, even if we're feeding our kids breakfast, is it satiating? Is it keeping their blood sugar levels stable through that first part of the day? And most times it's not. So then again, they have this crash and then they get irritable and they can't sit and they can't focus and they can't concentrate. So even if you feed your child real food, meaning like I said, eggs is my favorite thing to give if your kid can tolerate eggs in the morning. Even if you want to do sourdough bread and you even want to put, some sort of nut butter on it or what have you, just something satiating to keep them going in the morning, I think is so significant. Breakfast is one of those things for kids. It just sets up their whole day for success.
I love that. So, you're suggesting protein, and I think like fats and proteins are more satiating than carbs. So, when you think about a typical children's standard American breakfast, it's cereal, toast, waffle, pancakes, like all of sugar. So it's all of these high, heavy carbs. So if we can get back, and honestly, like you said, throwing an egg in a pan can take as much time as a cereal, making a bowl of cereal, it really can. So like just being able to just quickly do that multitask, load the dishwasher, do something, you can do it. And like having a sausage, I know I love going to natural grocers and they have like some organic sausages that you throw a sausage on. And I know maybe it will be hard for your kids at first, especially if they're used to eating cereals and high sugary foods. Do you have any suggestions for that? Like if they are used to that and how to get their palate to kind of change to use more of the higher protein fat foods?
Yes. Their belly is telling them what they want. So that's so important, I think, for parents to understand, is that they are craving the bacteria that exists in their bellies. So if they are eating a higher sugar, high carb, or processed food type diet, they're craving those foods. It's not because they're picky. It's that they truly are craving that. So then, like, to your question, so how are we changing the way our children are going to be eating? Because there's going to be so much pushback. That's the big worry. You can slowly integrate that. So I would say, instead of going from cereal to eggs, you say, okay, I'm gonna cook you an egg. How would you like it? You get to choose. Do you want to have it scrambled or do you want to have it over easy? So there's a little bit of control there. I'm also going to give you your cereal, but you're going to have it after your egg. The beauty of that is protein is quick to satiate the child. So they might not even be hungry enough for the cereal, at least not after a while, or they're not going to eat as much of it because, again, it's the healthy fats, it's the healthy proteins that fill them up and keep them full. So don't take it out right away. Over time, maybe it's then just half of a cereal bowl and now it's just like, a fourth of a cup. And soon they're used to starting with the egg and they're not really seeking out the cereal as much. So you can gradually decrease that from their diet.
I love that. And even like thinking about the cereals, you're changing the cereals. You're getting rid of the junky artificial food dye cereals and you're getting more organic or natural, a less sugar filled cereal to replace that with. And then it's that phases, right? And then even there, you're going to take it a next step further when they start kind of getting that addiction, because sugar is an addiction, especially for kids. And so we're going to we have to clean that and detox them out of their addiction. Mm-hmm. So once we do that, we can start like giving them things that have less sugar and they will do that. I also think you talked about you have 3 different girls at different ages. Even with Lainey, who's 2.5, when we're eating meals, I'm like, okay, Lainey, we'll have to put a protein in, just teaching her because she's smart and she'll figure it out. And so she knows that a meat is a protein. So it's like, okay, now it's time for a protein because we need to mix all of them. We need to have protein, carbs, and fats. It's really important to have them all. So at a young age, just starting to use those terms and letting them know, okay, if you have this, waffle, we always put protein mix in our waffle just to put it, whatever we can do. We put zucchini in it, but we put nut butter on top of it. And it's like, okay, let's put our protein on top of our carb, and like just little languages like that so that she knows that it's fueling her from different sources.
I love that.
Oh, okay. Let's talk about school, because school and meals, like let's say, I want to talk about when we were talking many months ago before the girls were going to school, and your experience with like the inability to bring in fruit for the kids. I'd love you to just kind of give people that scenario, because I think it's so common and it's so interesting as a society, as this is where we're at and how it's starting to change, hopefully.
So our oldest started kindergarten a couple of years ago. And so we're in the public setting, the public school system. And so we've always brought in their food to their daycares. So this has always been something they're used to. And in orientation for her, they said, okay, this is kind of how the day is going to look. And this is when lunchtime is. And then they talked about the snacks. And they said, okay, so, and the big focus was avoiding, the concerns for allergies. So avoiding nuts, avoiding all the most common allergen foods, which I wholeheartedly, I'm on board with. The options that they had for snacks that were either donated or provided by the school were specifically a Ritz cracker, but it had to be plain, and then like a goldfish cracker. There's 3 different types of crackers, I guess. I can't remember this, but they needed to be a specific brand, and it needed to be, plain. And after the orientation, I went to the teacher and I said, I'm excited for Remy to start. Just know that we've always brought in her food. And if it's okay with you, we're just going to have her, she usually just has a piece of whole fruit, mid-morning. So, it's going to be no fuss on your end. She's going to have it and she can open it. And there was pushback. Well, it's not on the list though. And again, I felt from the teacher, she just wants to follow the rules and she wants to protect the children. Part of me was also, we're talking about whole fruit here. I'm not talking about anything packaged. I'm not talking about anything related to, these common allergens. This is a banana.
Yeah.
And then she's like, well, just wanting to make sure that the kids don't feel like she's getting special treatment. I'm like, if they all want bananas, I would be more than happy to bring that in. Anyway, so I then had to move that forward to the principal, and there was still pushback. And there was this concern about, you're making an exception. And I think the biggest problem was that it was disruptive. I was disruptive by suggesting something different. And teachers are already taxed. School systems are already they're just trying to operate now on just keeping kids calm. And, there's just a lot that's going on. So that was just something disruptive. So I'm like, I'm sorry. I am not going to force my child to eat crackers in the morning right before lunch. What's that going to do? Cause them to not eat as much of their lunch that I'm bringing them. I'm like, I'm talking about whole fruit. I will keep it to whole fruit. The whole initiative right now in our public school system is trying to push whole food. So I was, he then granted me an exception and she was allowed to have her whole fruit. Fast forward this year, orientation, they were then offering, we're now doing blueberries, apples, and bananas. So I think the point to that story is, do what you can in your family and make those changes, make those, adjustments, whatever that is in terms of their diet. But know that you have a voice and you can bring about positive change in your communities, in your schools, in your daycares, or it's just going to have people more inquisitive or just question things. Well, why are they doing that? Oh, interesting. Well, maybe I'll do it. And so you're not trying to tell people what to do, but you're just leading by example. And so I think that that's so important to question things and to be an advocate for your child.
Yeah, that's so great. And it brings us back to the why, but why aren't whole fruits allowed? It's so silly. And I'm so glad that you you found the way in by saying, well, isn't this the initiative of the schools? And really, is it the initiative of the schools? And that's the frustrating part, right? It's just there's so many gaps there that need to be filled. And as you mentioned, being empowered, and this is your baby's body and your family. And if you can make the healthier decisions in this moment, it will definitely make your life easier down the road. If you don't have a kid that is suffering with ADHD or constantly sick because you're cleaning up their act right now, you will be so happy for that. And you might think that you're spending more money now on organic foods or whatever, but you're saving a lot of money for doctor bills in the future. I mean, there's so many offsets that you just don't even know. But I do know one thing, and I see pediatric cancer patients and I see pediatric illnesses, and the overfilling of the cup is definitely there. We are birthing sicker kids, and we need to help their immune systems. And so whatever we can do to decrease the chemicals, the foreign things that are entering into their body is so important. And we have to get empowered. We can't be afraid to ruffle feathers. And to me, it's frustrating as someone that is very vocal and will speak out, because I do have the stories of the background of why I do what I do. I'm not doing this for shits and giggles. I'm not doing this to stand out in front of out in the crowd. Like, I don't want to be different than everybody, but I see the way that people are sick, and I don't want that for our kids. Like you said, your kid's my kid. I don't want kids to suffer. And when I see things that could be easily changed, it's just really frustrating. And so I'm the same way. And I will go into the school and ask them to make changes, or at least an exception, so that my kid could have it. But Lainey, where she's going right now, they're so lovely about it. And like, they do snacks with the kids once a week, like where they make their own snack. And they're letting me bring in like organic raisins for it, or organic peanut butter, doing that. And I'm so grateful that they're allowing me to do that, because I have a resource to be able to do that. And then I get to do it for all the kids. Yeah. And so but I would have never, if I didn't ask. The answer is always no if you don't ask. So it's just kind of just being assertive. And what's the worst that's going to happen? They say no, or they look at you funny. Well, that's okay, because you're doing what's best for you and your family.
Yep. And another way you can look at it, if you want to be selfish, is how, if I get my kid to regulate their mood and they're not having these ups and downs with their blood sugar, dysregulation, they're going to be better kids. You're going to be able to handle it. The teachers are going to thank you for it, because they're actually going to be able to, focus and pay attention for longer periods of time. So do it to make your life easier, if that's part of what's going to push you to do it.
Totally. I know I'm going to say another example that I'm just thinking of now, because you talked about school, but talk about the bus driver. And I mean, it's constant bombardment, right? Like we constantly are getting bombarded with like these educational opportunities.
It hurts me to say this, because I love my daughter's bus driver. He is the sweetest man ever, and she just has this adorable relationship with him. But she would come home, and I mean, my daughter knows, sort of the limits that we have. There's just certain candies that we don't eat. And so she just brings home like handfuls, not a handful, like handfuls, plural, of candy that he just gives her as soon as she gets off the bus. She's like, Mom, I don't know what to do with this. Do I donate it? Do we have to throw it away? And then I feel crappy, because it's like, well, you kind of got excited about a gift he gave you, and then you kind of have to have that conversation. But it got to be like an everyday deal. So I called the school and talked to the head of transportation, and they said, oh, yep. And I said, I know the intention is there, and I love it. And he is so great with her. Is there a way we could swap out like candy for stickers if he still wants to provide something? Of course, he doesn't have to, or little toys or little erasers. And they said, absolutely, we'll talk with, the bus drivers. And then, yeah, how many days later she's coming home and she has like a sticker or something like that.
That's amazing.
And he gets to still give what he wants to, but
Yes.
that it's not something that I need to throw away every day.
He was never doing it for malintention. He's totally doing it to be an amazing person. And again, it's just like the tools, like, okay, well, we have this opportunity. Well, he doesn't get the significance like we do of the artificial dyes, sugars, and all that. So he didn't maybe think about stickers or something like that. So now he has that, and now he gives it to her. He gets to feel the joy of giving it. She gets to really feel the joy of receiving it, because she can actually use it on something. So, okay, I love that. Again, and it would still be happening if you didn't say something. So it is those little changes. Trying to think of what else I want to ask you. I know I put on here, like, as medical practitioners, as parents, we can feel exhausted by big agencies pushing, or systems that push certain treatments or protocols onto our kids. Can we talk about what you think. Do you think the bigger agencies like the CDC and those organizations, are they meaning to help people? Are they meaning to help a certain subclass of populations? Where do you think they're failing in helping the kids these days as you see them?
I think a lot of it's money driven. I mean, I'm going to be frank and say that. I don't necessarily know that their intention is to, focus on keeping our kids thriving, maybe keeping our kids safe and like more of this acute, like we don't want our children to die in an acute phase, but are we setting them up, are we setting them up to thrive and be healthy long-term? So you talk about the CDC. And so there are recommendations, there's guidelines that are, families are pushed to follow. And I think that every child is different and every kid's unique. And some kids can handle certain recommendations more than others. I know vaccines are very controversial and I'm not really going to go into them, but I will say that there is a schedule that's set and some kids can thrive on that schedule maybe, and some kids really reap the repercussions because their bodies are not the same. So I feel it's too much of a one size fits all, and that parents need to be empowered to look at their child and to see what's best for them. I am a practitioner where I feel like I'm pro-choice. So the mom, the dad, you get to decide what's best for you, and I will support that and give you all the tools and education possible to make you feel confident about that decision. I certainly don't push my opinion either way, but ultimately you're going to decide what you want to do. So I want to set you up for the most success with that decision. Hopefully that makes sense.
Yeah, it makes total sense. And I think that that's just really good to know that we can't use the CDC or big agencies as Bibles for living our lives because everybody's so different. So using them as high guidelines, like, okay, this is what one system is saying, and I know this other system, CDC doesn't incorporate natural holistic medicine. Let's just be real. So we know that there's this whole other side that is kind of just avoided. So if we can just kind of tap into some education and have some wisdom and tools from that side in as well, then we can get this whole approach. We can really figure out what is best for our specific kids. And we can use our intuition and our mama guts and our daddy guts to be like, oh yeah, this feels right for our family, or maybe this doesn't feel right. And I tell my patients, you can always make the decision later. You can't ever take anything away. You can always add to it. So if you feel rushed, like you said, vaccines, if you feel rushed into making that decision and you're not sure, wait. You can add it in. Next appointment, have another discussion. Okay, the discussion, you're ready for it. You know the pros and cons, and you've read the actual inserts for the vaccine. You know its risks and benefits, and you know the alternatives. If someone does get the measles, how bad is that? And you know the alternatives. If you've educated yourself and you're like, yep, I'm so good. Yep. That's all I want. I want people to be empowered in their decisions.
Yes.
And that will make them healthier. So, oh my goodness. Okay. Is there anything else that you can think of that you wanted to talk about with either ADHD or just in general pediatric functional medicine?
I guess a couple things. One is, if you're going to make these changes with your child and your family and you're all on board with this and you're speaking with your significant other, if you have a significant other, incorporate that child in that discussion and speak to them and have them go with you to the grocery store and say, hey, we're going to pick out these foods together and you're going to help me. And I know you're smart. You have a really smart brain. And so we're just going to make it even smarter, or find their intrinsic motivator. They want to run faster. They want to, remember there was a client I worked with, a patient, and he was in grade school and he wanted to read a chapter book a week. And that was not happening. And he was failing his math class. He wanted to be good at math. He wanted to read chapter books. So parents were all on board, excellent parents. They did all the hard rights. They addressed all the pillars and followed up with me. And he followed up with me, adorable. And it was, reading a chapter book a week, acing his math tests, The next year at parent-teacher conferences, he was the leader of the class. Prior to that, he was almost kicked off the school bus because he was so disruptive. Wow. So, and this was no medication involved. This was all just them addressing the deficiencies and the things in which he could now thrive. But he was a part of that. He was a part of that planning. And it all came back to, well, if we eat this type of cookie even, or if we eat this type of food, it's going to make your brain smarter.
Yeah.
And you're reading those chapter books and you're so smart.
Yes.
And the beauty of that was the parents were like, I felt like I met my son for the first time because there was this shell around this personality. And I know that wasn't him. And then this sort of blossomed. And that was, I mean, the best news ever.
Yeah.
Because it's like, this is your child. Your child is not this disruptive kid who needs a label the rest of his life. They're not a label. So let's set them up for success, have them be a part of that planning, and then give them all the attaboys. Oh, you did choose us on your own. You're so smart. I knew that you would.
I love that. Oh my gosh, that story makes me tingle. Like, that's why we do what we do, right? You're not only changing the trajectory for the child, you're changing it for the parents, you're changing it for their future children, the child's future children. Like, it's such a ripple effect. And that's amazing. I'm so glad that you are around and available and doing this stuff. So if you want to tell people where they can find you and your information, I'd love that.
Sure. Yeah. So you can stop in at the health spa. I take pediatric patients from cradle to grave. So any and all. So if you are a parent right now and you are wanting to bring them in, I can certainly see them in the clinic. If you are not local to Piasta, I also offer an extension of my practice here called Little Root Practitioner, or the Little Root Method. So you can go to littlerootpractitioner.com, or you can find me on Instagram, and I can then provide those services remotely if in the event, like I said, you're not local.
Love that. Okay, Maggie, thank you so much for taking the time today. I think it was really great. I can't wait to have you on next to talk about whatever we want to talk about, but thank you so much. Have a great day.
You too.